Good morning. In this video, I'm going to talk about the diabetes medication, and I've done some videos on diabetes before and diabetes medication, but this is slightly different because I'm going to emphasize why starting on certain medication, depending on people's comorbidity, makes all the difference. So somebody suppose may have a weight problem or may have a problem with a heart or kidney. Some people may be quite thin. Some people may have other comorbid condition, heart conditions. So choosing the right medicine makes all the difference and depends on several factors: weight, activity level, comorbid conditions, heart disease, kidney disease, etc. So I'm going to break it down how each of these factors impact the choice of diabetes medication and why getting it right from the beginning is so important for your health. So understanding the basics of diabetes medication. First, let's understand what we're talking about here. The main goal of diabetes medication, of course, is to control blood sugar. But thing is that there's no one size fits all approach. It has to be individualized. Now, oral medication like Metformin help insulin sensitivity. Injectables like GLP-1 receptor agonist or Ozempic, Mounjaro, etc., which may help lower sugar, even support weight loss. And then you have insulin therapy, which is usually for type 1, but lots of type 2 patients are insulin therapy as well. Then you have a diabetes medication which helps also weight management. And one of the biggest factor in determining which medication will work best for you is the weight consideration. And if you are overweight or obese, certain medication work much better than others. It won't make you gain weight, and that's the last thing you want. So GLP-1 agonist, Ozempic, Wegovy, Mounjaro, Zepbound, etc., are excellent because they help lower blood sugar and promote weight loss. Then you have SGLT2 inhibitors like Jardiance, Farxiga. They help weight loss by flushing out excess glucose through urine. So those are also very helpful. But on the other hand, if you're underweight, your doctor may avoid medications which cause weight loss. In that case, metformin and insulin may be a better option because they are less likely to impact your weight negatively. If you are underweight, you don't want to be losing more weight. Diabetes medication and activity level. Your activity plays a big role in determining the best treatment. If you're physically active and you exercise regularly, you may benefit from medications that improve insulin sensitivity and help lower sugar without causing lows, hypoglycemic lows. For example, metformin works well here because it doesn't cause hypoglycemia unless it's paired with other medication like a glipizide and similar medication. SGLT2 inhibitors like Farxiga and Jardiance, they also don't cause lows and they support weight loss, which is great for active individuals. However, if you struggle with exercise for any reasons or you have a sedentary lifestyle, your doctor may start you on medication that help you with weight loss and improve insulin resistance. For example, SGLT2 inhibitors like Farxiga, Jardiance, or GLP-1 agonist, Wegovy, Ozempic, Mounjaro, etc. Now, if somebody has diabetes and plus heart disease, that's really important consideration. If you have heart disease or you are at higher risk because of your habits, smoking, family history, hypercholesterolemia, etc. So in that case, medication choice will be influenced by protecting your heart. So in those cases, two medications stand out. GLP-1 agonist, these not only help blood sugar, but they also reduce the risk of heart disease, which is again Ozempic, Wegovy, Mounjaro, etc. And SGLT2 inhibitors, Jardians, and Farxiga kind of medication, they are highly recommended for people with both diabetes and heart disease because they are known to reduce risk of heart failure and improve heart health as well. So these medications do more than just manage sugar. They also improve heart health, which is crucial for people with diabetes. Now, let's talk about another situation. People with kidney disease. So let's consider kidney health. If you have chronic kidney disease, your doctor is going to choose the medication that protect your kidney. And some SGLT2 inhibitors like Jardians and Farxiga, they are great choices for those with diabetes and CKD, and they help protect kidney function, reduce risk of kidney failure. GLP-1 agonist can also help reduce inflammation and protect your kidneys. However, the medications like Metformin may need adjustment in dose or should be avoided completely if the kidney function is compromised because it can lead to lactic acidosis, which is a very severe health condition which requires admission to the hospital. But anytime if you are on metformin for any other reason, you have a kidney problem, a doctor need to check your kidney function very closely. Diabetes and neuropathy. Some people have neuropathy or a stroke issue. In that case, managing blood sugar is very important because the tighter you bring your blood sugar to normal, the better it is. In this case also GLP-1 agonists and SGLT2 inhibitors are very helpful. They not only control the blood sugar, they reduce inflammation and improve circulation. So controlling blood sugar is one of the most effective way to prevent nerve damage from worsening. Diabetes medication and low blood sugar risk hypoglycemia. If you are prone to low blood sugar hypoglycemia, your doctor should avoid medication that increase the risk of lows. They include sulfonylureas like glipizide, glimepiride, glyburide, and insulin. If you don't monitor your blood glucose closely, more and more people have continuous glucose monitoring these days, so that's making it better to take charge of your blood sugar fluctuation. Instead, metformin and DPP4 inhibitors, which is sitagliptin, alogliptin kind of medication, or GLP-1 agonist and SGLT2 inhibitors are usually recommended because they generally do not typically cause hypoglycemia. So if you are prone to hypoglycemia, if you are not checking your blood sugar for any reason, you should stay away from sulfonylureas, which is glipizide, glyburide, and glimepiride, and insulin. So in conclusion, I would like to sum it up like right medication for diabetes is about more than just lowering blood sugar. It's about taking your weight, activity level, other health condition, heart disease, kidney disease, neuropathy into account. That's why your doctor would consider all these factors before prescribing your treatment plan. And starting right medicine from the very beginning will help you control blood sugar and also reduce the risk of complication. Okay? If you're managing diabetes, make sure you're working closely with your doctor to determine the best treatment plan for you. So thank you for watching.